Hey guys, welcome back to askCamDoc. My name's Shane and I'm a final year medical student and possibly a newly qualified doctor and neuroscience supervisor at the University of Cambridge. And today I want to talk about emerging new evidence regarding the treatment of COVID-19 or coronavirus. The COVID-19 pandemic started in the Wuhan province of China and it has spread rapidly all around the world. One of the main problems that we've faced when it comes to treating this new coronavirus is the uncertainty. However, emerging new evidence suggests that a medication known as chloroquine shows promising results when it comes to treating patients with COVID-19. This is a medication known to be safe and cheap and has been used for the past few decades when it comes to treating malaria. Today I'll talk about two new papers that have emerged in the last few months, and in fact the most recent paper emerged just a few days ago that showed promising results when it comes to using chloroquine or hydroxychloroquine in treating patients infected with coronavirus. The first paper used a medication known as chloroquine sulfate and the second paper used a medication known as hydroxychloroquine and compared it to the chloroquine sulfate that I mentioned previously. I'll also go on to discuss the possible mechanism of action and why hydroxychloroquine could be so effective. The results have been so promising that in China and parts of the US have already started using hydroxychloroquine as empirical therapy for patients infected with this strain of coronavirus. So before I begin, a few semantics. So COVID-19 is actually the disease and that stands for coronavirus induced disease 19, and it's caused by a virus known as SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. So once we've got that out of the way, let's get to it. So the first paper was by Gao et al. And the title reads, Chloroquine phosphate has shown apparent efficacy in treatment of COVID-19 associated pneumonia in clinical studies. Essentially, this followed on from a in vitro trial study that was done previously. In vitro essentially means we look at cells that have been infected with this strain of coronavirus outside of the human body, so it's artificially infected, and then we test different medications to see how good they are at overcoming this strain of coronavirus. So chloroquine sulfate was used in this in vitro trial and it showed promising results, and then it was kind of expedited in order to use in humans, and it was used around 10 hospitals across the Wuhan province, treating more than 100 patients infected with this strain of coronavirus. The results were very promising. It showed that chloroquine phosphate was far superior than controls in inhibiting the exacerbation of pneumonia, improving lung imaging findings, and shortening the disease course. Alongside this, it's also very important to consider the safety profile. Chloroquine is known to be a very safe drug which has been used to treat malaria for the past 70 years. Emerging evidence shows that it is quite safe to use in patients infected with this strain of coronavirus, and no adverse effects have been reported so far. The second paper I want to talk about was published only a few days ago, and that was by Yao et al. And the title reads, In vitro antiviral activity and projection of optimized dosing design of hydroxychloroquine for the treatment of severe acute respiratory syndrome coronavirus 2. Okay, big title. Essentially, they found that when they trialed it in vitro studies, hydroxychloroquine, a brother to chloroquine, was more effective than chloroquine itself. One of the major things that resulted from this trial was actually a recommendation of what dosing strategy we can use in treating patients who have this strain of coronavirus requiring hospital care and management. So the suggestion was this: a loading dose of 400 milligrams twice daily of hydroxychloroquine sulfate given orally, followed by a maintenance dose of 200 milligrams given twice daily for 4 days is recommended for SARS-CoV-2 infection. So how are chloroquine sulfate and hydroxychloroquine effective against this strain of coronavirus? Well, basically, there's proposed to be two mechanisms of action. One is an antiviral effect. Chloroquine sulfate is proposed to alter the endosomal pH, which affects the fusion of the virus to the cell. The second is the anti-inflammatory or immunomodulatory effect. To understand why this is important, we need to look at what happens when people are infected with SARS-CoV-2. So when some people are infected, they mount an aberrant immune response, which means it is very severe and it causes something called severe acute respiratory distress syndrome. So essentially the immune response that's mounted causes the lungs to not function as well. So it's proposed that this antiviral or immunomodulatory effect could be the biggest factor in the efficacy behind chloroquine sulfate and hydroxychloroquine in essentially dampening down our immune system such that it doesn't produce such a severe immune response, causing our lungs to fail. Whilst China and parts of the US have already implemented hydroxychloroquine in treating patients infected with this strain of coronavirus, we need to be mindful of the fact that this is currently unlicensed for this strain of coronavirus. What this means for us is, whilst this is promising, we need more research that needs to be done in order for us to get to the stage where yes, we can license this and can be confident that this is an effective, safe treatment. So hopefully you guys found this video very useful in terms of understanding the emerging new evidence behind the treatment of this new strain of coronavirus. But that's it for me for today, and I'll see you guys next time.